Good morning, this is Dr. Zev Zelenko, and I want to give you a very important update. Since last Wednesday, March 18th, till yesterday, March 26th, my office saw 699 patients with coronavirus, either diagnosed by test or by symptoms and exposure. Out of those patients, a select population, a select high-risk group were treated with medication, which you're aware of, that 3-drug combination. And I'd like to report that since then, and Hashem should help, there have been 0 deaths in that group and 0 intubations, meaning there's no breathing pipe, no respirators. There are 4 patients that are admitted in the hospital with pneumonia on IV antibiotics without a respirator, and Mitzvah Hashem, they'll be okay. Compared to the world statistics, 4.5% of people with coronavirus die, according to the world. In the United States, the statistics are 1.5% of the people that have coronavirus die. In Monroe, the statistics is 0%. Baruch Hashem. This information has been forwarded to the highest levels of the federal government. I am confident that that information will be presented to the President of the United States, God willing. I am also aware that this information will be presented to the Prime Minister of Israel as we speak. I want to thank Hashem for his chesed, that he has helped helped me discover an approach that may be helpful. Mitzvah Hashem, I hope it works out. It's now in the hands of the big people in the world, and let's hope that it makes a difference. I have one very strong request. We're running low on medication. There's thousands of patients that need it. If anyone has any leftover medication or didn't use it, I beg you to return it so that it could be used for other people. I hope everyone is healthy and getting better, and have a wonderful Shabbos. Hello. This video is directed directly to the Prime Minister of Israel, Bibi Netanyahu, and to the Ministry of Health of Israel. My name is Dr. Vladimir Zev Zelenko. I'm a board-certified family practitioner in Monroe, New York. I have been on the front lines of treating the coronavirus for a few weeks, and I'd like to report to you, consider it a frontline battlefield assessment of what I have seen. My observations were written down and have been submitted to the highest levels of the federal government, and they're currently reviewing, and actually as of yesterday, the FDA approved, Vice President Pence approved the use of hydroxychloroquine in the treatment of coronavirus to every single American who needs it. So the purpose of this video is to inform the highest levels of the Israeli government of my findings, and hopefully your government could evaluate and implement these approaches right away. My observations have been that if you treat patients with a combination of certain medication, which I will present to you, early in the outpatient setting, before they develop respiratory symptoms, that the majority of them will not need to go to the hospital, will not need to be intubated, and probably will not die. I classify patients into 3 categories. Young and healthy with no respiratory symptoms. I do not treat those patients. Anyone with shortness of breath, I will treat. Anyone who has symptoms and are considered high risk, I will treat. I've treated hundreds of patients, and since I've started using this method, I have only had one patient yesterday end up in the hospital out of hundreds. The results are remarkable, and the respiratory symptoms seem to resolve as fast as 4 hours, on average 12 hours. So the point of this video, I want to summarize 5 principles. I think we need to do clinical trials to assess this approach, but simultaneously implement it empirically because people are dying. The side effect profile of these medications is well known. It's safe, in most cases, well tolerated, and very cheap. They should be used right away. We need to inform and disseminate this information to every single doctor who's treating patients, specifically in the outpatient setting, so that they are able to initiate treatment early. This will avoid the need for hospitalization. It would avoid the need for intubation, and will lessen the burden on the health system. Furthermore, we need to reinforce social distancing, hand washing. Israel has done a tremendous job in locking down the country. That needs to continue. And the final thing, this is to the people of Israel: if you're young and healthy, do not have any medical problems, and you have the coronavirus, you will be okay. We have to reduce the panic. There's no room for panic now. I sincerely give you a bracha, Mr. Prime Minister, and all the government and all the people of Israel, that we should get over this Megefa, and that we should all be healthy and merit peace everywhere in the world. Again, I'm Dr. Vladimir Zelenko. Thank you very much. I need to again reassure the young people, and I understand there's a lot of anxiety. Young people who get this infection, you'll get better. And when I mean young people, I mean people younger than 60 and with mild symptoms. You all will get better. Only thing to worry about is shortness of breath, which in most cases doesn't happen. If you have the infection, stay home. Everyone should stay home, actually. But if you have the infection, drink a lot of fluids. Take Tylenol, not Motrin. Motrin is not considered safe. That also means the drugs like Pepto-Bismol, which has in it Motrin-like medication, should not be taken. When I say Motrin, I mean Motrin, ibuprofen, Advil, naproxen, Indocin, Excedrin, any medication that has something called an NSAID, non-steroidal anti-inflammatory medication, should not be taken. And if you have any confusion, you should ask your doctor. It seems that only Tylenol is considered safe for now in treating temperature with patients with the coronavirus. There seems to be some confusion about hydroxychloroquine availability. Governor Cuomo made an executive order limiting its use, and yet yesterday the Vice President Pence made an announcement that every American who needs it is allowed to have it. So there seems to be some type of confusion or conflict between the federal government and the New York State government. I'm working on trying to clarify that confusion, and when I know something, I will let you know. I'm in contact with the highest levels of the federal government right now. So if they respond to me, I will let you know. And I would like to ask you for some help. I would like to disseminate my protocols to as many doctors everywhere around the world as possible. I've had almost 100 medical professionals, doctors from around the world contact me, and I've been sending out my protocols. People are getting really good results, thank God. Baruch Hashem. And I have this today with a phone call meeting with the Ministry of Health of Israel, a representative of the Ministry of Health, and they're interested in incorporating and adopting these protocols because they seem to work. Baruch Hashem. So anyone who's listening, and if you have access to any doctors, any politicians, I would like to disseminate and send them my printed protocols. My email, no, I don't want to do it this way. I will post it on the internet somehow, these protocols, and they'll be made available to anyone who wants them. So please try to help spread knowledge, because I think that will help a lot of people, but more importantly, slow down or even end sooner than later this crisis. I thank you again, and hope you're feeling well. Hashem should bench all of you, and I think we need Mashiach now. Good morning, it's Dr. Zelenko. Excuse my voice, I'm losing it from talking so much. I want to address some few issues. First of all, regarding that letter that was sent around, it's not important, doesn't affect me, it doesn't bother me. What's more, and I michael everyone who was involved in writing it, and I want to move on. This is a time of a megefa, a plague, and I think we need to focus on solutions and positive acts of goodness and kindness and positive things. So I michael everyone. I hope there's no negative outcomes, and I think we need to only look forward and help as many people as possible.